We're a little bit ahead of where we were, but we're not as far as we would like to be. And by that, I mean the GAS study, which was a multinational prospective randomized trial, looked at the effects of general anesthesia versus awake regional anesthesia on infants less than 60 postmenstrual weeks of age. And we found that when we looked at these patients or children at ages 2 and at ages 5, there was no intellectual difference between those that got the awake regional, meaning they were not exposed to general anesthesia, and those that were exposed to regional anesthesia. However, we still have massive knowledge gaps on the effects of repetitive general anesthetics and the effects of prolonged general anesthesia and the effects of prolonged sedation in the intensive care unit. So we're moving forward, we're progressing, but there's still a lot of work that needs to be done.
There's a lot that needs to be done, both in preclinical and clinical arena in years to come. As far as the preclinical research is concerned, we have to continue to investigate the mechanisms that are relevant to this neurotoxic phenomenon so that we can devise protective strategies. On the clinical side, I would think that continuing with retrospective analyses as well as to continue to do well-designed prospective studies would be crucially important so that we can, first of all, recognize all aspects of unwanted effects of anesthetics and also find ways to perhaps move on with the field of pediatric anesthesia.
A large number of studies have now been done evaluating a variety of different neurodevelopmental outcomes and cognitive domains in children who have been exposed to surgery and anesthesia. And specifically, children who have had surgery and anesthesia appear to have a higher incidence of an ADH diagnosis and behavioral problems. At this point, we still don't know if this increase in behavioral problems is due to the anesthetic medication, but there have been some advances in the field in that we now have a better idea of which outcomes to look at. There are still important questions that we do need to answer. Specifically, are these increases in behavioral problems caused by the anesthetic agents or other factors that are unrelated? What is the mechanism of injury? Are there any mitigating strategies? And finally, which children are most at risk?
The problem that this field has been plagued with for over 20 years is the fact that the studies, good, well-designed clinical studies, are very difficult to come up with and actually may be very well impossible because prolonged anesthesia exposure or repeated anesthesia exposure in children usually happens when they are seriously ill or have a chronic disease that requires multiple trips to the operating room or a long stay in the intensive care unit. Therefore, it may be something that is hard to prove beyond reasonable doubt. The question, though, is that even important at this point in time? Since we have so many very solid pieces of evidence in a variety of animal species, including non-human primates, I think it is safe to say that the phenomenon does exist, although we may not be able to design a clinical study to prove it beyond reasonable doubt.
We talk a lot about biomarkers. What is a biomarker? So a biomarker is a change in the body that happens as a result of the exposure that we can measure relatively soon after the anesthetic exposure. And if we can do that and then correlate it with a long-term neurodevelopmental outcome, we think that is very important.
And biomarkers can take different forms. They may be a substance in blood that identifies injury to the brain, but more often they're imaging, sophisticated imaging studies, and some of those studies have been done.
One of the most important biomarkers is actually brain MRI, magnetic resonance imaging of the brain. There is some data, both in non-human primates and in a few small studies in children, that there are changes on the MRI. And if we can correlate that with long-term outcomes, that will be a very major step forward. So I think that's one of the studies we should really try to pursue.
It's very difficult. And as part of many groups that have worked on trying to design studies, There's lots of issues with feasibility, lots of issues with the amount of money that it would take to do these trials. I think it's possible.
Funds are essential to answer some of these questions, particularly for the large cohort studies to better define the outcome of in children in detail who have had procedures. It's an increasingly difficult environment around the world to get funding for research. Particularly difficult in this situation because funders often, they want a quick return. And when you're looking at the long-term outcome in children, there isn't a quick return. It may take years to actually get the answer. So it's very difficult to fund these studies. It is crucial when we're seeking for the substantial amount of money we need to fund it that we have seed funding. Seed funding is where a relatively small amount of money can show that a project is feasible or to collect some preliminary data. Absolutely necessary to have that seed funding so that we can then do a proof of concept study before we have any chance of getting substantial grant funding from the NIH or any of the other equivalent organisations.
And we need more information to determine the magnitude of this issue and if there's a better approach, a better way to address this particular problem. So SmartTots is dedicated to that, and because millions of children undergo anesthesia in the United States and around the world every year, this question and this field of research remains vital, and SmartTots is dedicated to help finding the answers.